Welcome. In this video, we'll be discussing silicosis, a serious lung disease caused by inhaling crystalline silica dust. We'll explore the causes, how it affects your lungs, who's at risk, the symptoms to watch out for, how it's diagnosed, and what can be done to manage and prevent this debilitating condition. Silicosis is caused by breathing in tiny particles of crystalline silica. Silica is a common mineral found in materials like sand, rock, and mineral ores such as quartz. Certain jobs, such as mining, quarrying, sandblasting, construction, and work in foundries, involve disturbing these materials, releasing silica dust into the air. When inhaled, these particles can become trapped in the lungs, leading to inflammation and scarring. Once inhaled, silica particles trigger an immune response in the lungs. Macrophages, specialized immune cells, attempt to engulf the silica particles. However, silica is toxic to these cells. When macrophages die, they release inflammatory substances that stimulate fibroblasts, cells responsible for producing collagen. Over time, this chronic inflammation and collagen deposition lead to the formation of nodular lesions, or scar tissue in the lungs. This scarring stiffens the lungs, reduces their ability to expand and contract, and impairs gas exchange, ultimately reducing the amount of oxygen that can enter the bloodstream. Silicosis is primarily an occupational disease, meaning it predominantly affects individuals exposed to silica dust in their workplaces. The prevalence is highest in industries with significant silica exposure, such as mining, construction, and sandblasting. While developed countries have implemented regulations to minimize exposure, silicosis remains a significant concern in developing nations with less stringent safety standards. Certain populations, like those pre-existing lung conditions or smokers, may also be at a higher risk of developing silicosis after exposure. The symptoms of silicosis can vary depending on the severity and type of the disease. In early stages, individuals may experience no symptoms at all. As the disease progresses, symptoms can include shortness of breath, especially during exertion, a persistent cough, which may or may not produce phlegm, fatigue and weakness, chest pain, and in advanced cases, respiratory failure. The symptoms can sometimes mimic other lung diseases, making accurate diagnosis crucial. Diagnosing silicosis involves a combination of factors. A detailed medical history, including occupational history and potential silica exposure, is essential. A physical examination can reveal abnormal lung sounds. Chest X-rays and CT scans are crucial for visualizing the characteristic nodular lesions and scarring in the lungs. Pulmonary function tests, which measure lung capacity and airflow, can help assess the extent of lung damage. In some cases, a lung biopsy may be necessary to confirm the diagnosis. Silicosis is generally classified into three main types: chronic silicosis, accelerated silicosis, and acute silicosis. Chronic silicosis is the most common form and develops after 10 or more years of exposure to relatively low levels of silica dust. Accelerated silicosis develops more rapidly, typically within 5 to 10 years, after exposure to higher concentrations of silica. Acute silicosis is the least common and most severe form, occurring after short-term exposure to very high levels of silica dust. It can lead to rapid lung damage and respiratory failure. Unfortunately, there is no cure for silicosis. Treatment focuses on managing symptoms and preventing further lung damage. This may include smoking cessation, if applicable, bronchodilators to help open airways, oxygen therapy to improve oxygen levels, pulmonary rehabilitation to improve lung function and exercise tolerance, and treatment of any secondary infections. In severe cases, a lung transplant may be considered. Prevention is the most effective way to combat silicosis. This involves implementing strict workplace safety measures to minimize silica dust exposure. These measures include using engineering controls, such as ventilation systems and wet methods to suppress dust, providing workers with appropriate respiratory protection, such as respirators, conducting regular air monitoring to assess silica dust levels, and providing workers with education and training on the hazards of silica exposure and proper safety procedures. The prognosis for silicosis varies depending on the type and severity of the disease. Chronic silicosis can progress slowly, while accelerated and acute silicosis can lead to more rapid lung damage and disability. Silicosis can increase the risk of other lung diseases, such as tuberculosis and lung cancer. Research is ongoing to explore potential therapies, including anti-inflammatory medications and drugs that can reduce collagen deposition, to slow the progression of the disease and improve the quality of life for individuals with silicosis. Ongoing advancements in early detection and prevention strategies offer hope for reducing the burden of this preventable lung disease.